Hi, my name is Jen Ivanovich. I work as a genetic counselor at the Siteman Cancer Center, and I have the privilege to work with people and families who have cancer. I also direct the Young Women's Breast Cancer Program, and our program, with the support of the Siteman Cancer Center, is bringing you this video series. Today we're going to talk about the family medical history, why it's important to know this information, how to document your family history, and at the end of the video we'll provide an example of how you can use this information in planning your medical care. As genetic research continues, we begin to unravel the genetic interactions and bases for all diseases, including cancer. Knowing your family history allows us to determine if your family has an inherited condition. We all know and love someone who's been diagnosed with cancer. And for the majority of people who've been diagnosed, they have a sporadic form of cancer. That is, the cancer formed in that part of the body, but they did not inherit a gene change that led to that cancer formation. However, a percentage of people with cancer do have a hereditary form. They have inherited a gene mutation that led to the development of that cancer. And it's those families that have an increased or even high cancer risk. We have an opportunity to help them. And for young adults, this information is incredibly relevant because more young adults will have one of these inherited gene changes as compared to older people who are diagnosed with cancer. Let's first talk about why it's important to know your family history. Having this information allows us to assess your family-based cancer risk and determine if your family has an increased risk to develop cancer, or in some families have hereditary cancer. We use a variety of pieces of information to evaluate this possibility. At the cornerstone of this evaluation is the family medical history. We're also utilizing information about the details regarding your specific cancer diagnosis, your personal health history, and in some cases we utilize genetic testing to help guide us. This information is incredibly important because it allows us to assess your family-based risk and determine if your family has an increased cancer risk. You might utilize this information in your treatment planning. Even if you're under very close care with your medical team, this information could be helpful to your children, siblings, and extended family member as they plan their medical care too. In order to provide your family with the best assessment, we need accurate information. As you collect information from your family members, an important part of that collection will be collecting medical records. Medical records can be obtained from the hospital or physician where you received your care. Every person with cancer has a right to their medical records. And in particular, one piece of information that we need is the pathology report. That tells us where that cancer arose and specific details about that cancer that can be incredibly helpful. If a family member has passed away, the living next of kin can release those medical records. That includes a spouse, if the person was married when they passed, or adult children may release those records. It's important to note that paper records are only maintained for a period of time. Most hospitals keep those records for 5 to 10 years. With the advent and implementation of electronic medical records, records hopefully will be kept for a longer period of time. But I encourage you to collect those records now before they're destroyed. Sometimes medical records aren't available and we have to collect a death certificate. These can be obtained by any person in the family and are often available through the State Vital Statistics Office. On our webpage, you'll find a copy of the Missouri request form for death certificates. Some of the details provided in the medical records can be incredibly helpful in planning and assessing a family's cancer risk. Let me give you 2 examples. As you see in the slide, we have 2 women who present with breast cancer at a young age, both diagnosed at 32 years of age. And even with a brief history, we see that their fathers were both diagnosed with gastric cancer. Gastric cancer is cancer of the stomach. This information is incredibly helpful to have, but details from the medical records could potentially change our assessment. As you see on the next slide, we get some more information from the medical records. In family 1, the young woman with breast cancer has a ductal breast cancer, and her father has a specific type of gastric cancer called gastrointestinal stromal tumor. In family 2, even though we have a young woman with breast cancer and a father with gastric cancer, the types of cancers are different. She has a lobular breast cancer, and her father has a diffuse, or what we refer to as a signet ring carcinoma. These details might be not shared among family members, but are incredibly important in our assessment for this family. In these two brief examples, our assessment for family 1, our diagnosis, and medical recommendations would be different than for family 2. The information provided in the medical records was incredibly helpful as we proceed forward with the assessment for each family. Now let's consider how the family history information might be useful in planning a family's medical care. Let's look at a different pedigree. We have a 28-year-old man who's been diagnosed with colon cancer. We put an arrow by him because he's the one who is seeking information. He has a daughter. He also has a sister. And it's very clear from the family history that he has a maternal family history of cancer that's consistent and diagnostic for hereditary cancer. He has multiple affected relatives in multiple generations. There are many people in this family who've been diagnosed at a young age. This family clearly has hereditary cancer. And with this information from the family history, we can make a diagnosis. We know this family has Lynch syndrome. There's a great deal of information available about families who have Lynch syndrome, and we use that information about the cancer risk associated with that particular syndrome to help guide in planning this family's medical care. We would institute early colonoscopy screening for this family, beginning prior to 20 years of age, given the early onset of cancer in this family. Early and frequent gynecologic surveillance for uterine and ovarian cancer would also be recommended. Given the history of the small bowel cancer and gastric cancer among family members, upper endoscopy surveillance would also be recommended. These are all positive changes that this family can take to be proactive in their health and to address their family-based risk. Now please note, I've said nothing about genetic testing. We haven't used genetic testing yet in this family to guide their care. But genetic testing is possible and may help us to distinguish who in the family is at higher risk and who is not. But it all started with the family medical history. This family knew their history and the pattern was very clear. So no matter what tool you use, whether it be our form that you download from our webpage or another form that you find on the internet, I encourage you to document your family history. Share that information with your doctor and update it regularly with your family. Make your family medical history part of your family story. Thanks so much for watching.